go ahead and hit the OK, got it, or something button. Okay, so I'll start out by introducing myself. My name is Naomi Manuel, and I'm with the Epilepsy Foundation of Hawaii. Our foundation's mission is to lead the fight to overcome the challenges of living with epilepsy and to accelerate therapies, to stop seizures, find cures, and save lives. We as an organization provide education like these types of talks you're here for today. We offer seizure first aid certification training, advocacy, referrals, and all kinds of support for individuals, caregivers, and the community impacted by seizures. Before I introduce our speaker today, I want to let everyone know, if they didn't already know it, that November is Epilepsy Awareness Month. Every month should be. Are we back? Can you guys hear me? I can't even hear you guys. Can you hear me? Okay.
Can you guys hear me?
Mm-hmm.
Yes.
Okay, I need to go outside. I'm so sorry. Jesus Christ, you guys, I'm so sorry. Not professional, but it is what it is right now, okay? Can you still see my screen?
Yep.
Okay, so I'll just go through this really quickly. This month is November Epilepsy Awareness Month, and throughout the month of November, we have a Hawaii Epilepsy Awareness Month speaker series. And we have a number of different talks you can see here on the screen, like the one today. I hope that you get to go to other talks as well besides the ones today. I am going to stop my screen right now to introduce our speaker and kind of do some housekeeping, if that's okay with you guys. So Victoria, you can go ahead and get your screen up as.
Okay, I'll share my screen.
As I talk this through, yeah?
Oh, it says host disabled participant screen sharing.
Of course, of course. I did not do that, but I will allow you to do that right now.
Okay.
Okay, so as you get your screen up,
Right.
I am going to introduce you. Well, before I do that though, I wanted to also say that our Hawaii Epilepsy Education Speaker Series is a spinoff of our education conference that's usually held in November. And it's held in person, but of course, like a lot of things due to COVID, we've gone virtual with our education talks, which has actually allowed us to safely reach a broader audience. Besides our speaker today, I'd also like to thank our sponsors, VNS Therapy, LivaNova, ASI, Greenwich Biosciences, Ogenics, XK Life Science, and Medtronics for supporting the Hawaii Epilepsy Awareness Month speaker series. Their support really assists us to get important and critical information and resources out to you and our epilepsy community here in Hawaii, as well as beyond. And with that said, we really want to thank our speaker today, epileptologist Dr. Vicotira Wong, for taking the time out of her busy schedule to share a branch of her expertise, which is epilepsy. But she's going to talk with us today about what epilepsy centers are, how they're accredited, and how they deliver expert level care to people living with epilepsy. She did say that it's going to be really fast. I hope that everyone has a ton of questions
Back. Right. Hey, Naomi, it looks like you're muted, but your audio was kind of going in and out. I don't know if I should just get started or what.
Before you get started, when I'm gone, can you guys see yourselves? Or does it stop the whole meeting?
We can see ourselves. I think on my end it seems okay, but your audio and video keep going in and out and then get lost.
Okay, let me introduce you real quick and then you can get started, okay?
All right.
Because it's important to know who you are. So Dr. Vicotira Wong is a neurologist who specializes in epilepsy care and electroencephalography, or EEG. She is the current medical director of epilepsy and neurophysiology at the Queen's Medical Center. She is an associate clinical professor in the Division of Neurology at the University of Hawaii, John A. Burns School of Medicine, or JABSOM. She completed her medical school training at JABSOM, her neurology residency at the University of California, Davis, and her fellowship training at the University of Michigan. She spends her free time with her typewriter collection and doing talks for the Epilepsy Foundation of Hawaii. And she is one of our wonderful board members. So Victoria, go ahead and take it.
Thanks for that introduction. So the topic I am discussing today is what is a level 4 epilepsy center. As Naomi mentioned, I'm an epileptologist at Queens. Yeah, and these are my disclosures. I am on the board of directors of the Epilepsy Foundation of Hawaii, and I'm the medical director of the Queens Comprehensive Epilepsy Center. I don't have any other financial disclosures. I'm not affiliated with any of the sponsoring organizations that Naomi had mentioned. So I'm going to actually answer a few questions today beyond what is a level 4 epilepsy center. So just in general, I'm going to talk about epilepsy centers and what the different levels are. I'm going to answer the question of what is an epileptologist and what are the organizations who are responsible for these credentials. So first of all, you might hear the term comprehensive epilepsy center. So what is an epilepsy center? In general, an epilepsy center is a place that takes a team approach to epilepsy diagnosis and treatment. So rather than seeing an individual neurologist, a general neurologist, an epilepsy center has first and foremost epileptologists who are neurologists with specific expertise in treating seizures and reading EEGs. So I'll talk a little bit more about that later. An epilepsy center also has neurosurgeons. So these are brain surgeons that they may be removing brain tumors or blood vessel abnormalities in the brain. If somebody has seizures coming from a specific focus in the brain, a specific part of the brain, neurosurgeons may be involved in resecting that epilepsy focus, so taking out the part of the brain that generates seizures, or they may be involved in placement of epilepsy devices, so vagus nerve stimulation or responsive neurostimulation. An epilepsy center may have neuropsychologists who are responsible for testing memory and cognition. So people who have epilepsy often do have issues with memory. So a neuropsychologist can help tease that out and provide more information about how severe it is or different aspects of memory or cognitive issues. Or a neuropsychologist may also be involved in pre-surgical evaluation for somebody that's about to get epilepsy surgery and needs to know more about what parts of the brain are doing what. Neuroradiologists are specialists in reading brain scans, brain and spine scans, but when somebody has seizures or epilepsy and they get an MRI of the brain, for example, a neuroradiologist, they specialize in looking at those specific parts of the brain that may be generating seizures. An epilepsy center has nurse specialists. So, for example, a registered nurse that may provide epilepsy education to patients or provide information about different testing modalities. And additionally, in an epilepsy monitoring unit, the nurses may be specially trained to know how to respond to people who have seizures. EEG technologists are the people who, when somebody gets an EEG, brainwave testing, the EEG technologists measure out where the electrodes on the brain go. And there's also epilepsy monitoring unit technologists who are responsible for helping out in an epilepsy monitoring unit, which I'll also talk about later in this talk. There's also social workers, case managers, and a lot of people, or a lot of support staff also not mentioned here, for example, medical assistants, lab technicians, pharmacists, etc. So what does an epilepsy center provide? The main two purposes of an epilepsy center is really for diagnosis and treatment of epilepsy. So if somebody is having seizures or seizure-like episodes, an epilepsy center can help elucidate that diagnosis to figure out, are these seizures, first of all, and if they are seizures, what type of seizures are they, and is there a diagnosis of epilepsy? So I've talked about this in prior talks, but epilepsy, the definition of epilepsy is somebody whose brain is prone to generating seizures, or somebody that has had at least 2 unprovoked seizures. An epilepsy center also provides treatment for a wide variety of different patient types who have different seizures and epilepsy diagnoses. So for example, there can be just routine care of individuals who have well-controlled seizures. So often there's room for improvement, that even if somebody has epilepsy and their seizures are under good control, there may be options for maybe medications with fewer side effects, medications that don't have long-term side effects. If somebody is having side effects, we often discuss different options. If somebody has trouble remembering twice a day dosed medication, we may suggest a once a day dosed medication, for example. And also, we look at medication interactions. There's a lot that we consider. If somebody has difficult to control seizures, what we call refractory epilepsy, then oftentimes there can be a lot done to improve that. So whether it's trying newer medications or medication combinations, epilepsy surgery, epilepsy diets, epilepsy devices, etc. Somebody who was recently hospitalized, so sometimes people have severe traumatic brain injury or bleeding in the brain for some reason. So people who have seizures after that or end up on a seizure medication, an epilepsy center would provide care for that population. There's also special populations, for example, the pediatric population that's making their transition into adolescence and adulthood, as well as elderly populations that may have other a lot of medications, for example, or be more sensitive to seizure medications, may need special attention to their seizure medications. Individuals who are contemplating pregnancy in the future or who are currently pregnant may benefit from the expertise of an epilepsy center, and also individuals who have many other medical conditions, for example, transplant patients or patients who have heart conditions or liver conditions. There's some complexity as far as some medications either interacting with those medications or making that condition worse. So lots of different services that are provided at a comprehensive epilepsy center. So the goal for treatment of epilepsy is always going to be no seizures, no side effects, and that's not always possible, but that's really the goal and the mainstay of epilepsy treatment, to try to reach that goal. So the NAEC, which I'll talk about in the next slide, the National Association of Epilepsy Centers, really focuses on these 4 questions for, how an epilepsy center can especially be helpful. These are situations where, if you're having seizures despite treatment for more than 1 year, so you have uncontrolled seizures and it's not getting, your seizures are not under full control, or if you're continuing to have seizures despite treatment with 2 or more medication trials, if you're on seizure medications and having unacceptable side effects, or if you're pregnant or want to become pregnant, then that group of people should definitely be seeking care at an epilepsy center. So NAEC, the National Association of Epilepsy Centers, is the accrediting association for epilepsy centers. So this is a nonprofit association that was founded in 1987, and their goal was really to oversee standards of care for epilepsy centers. And so they provide accreditation. So in the US, there's approximately 250 specialized epilepsy centers. With the most recent statistics, there were 199 level 4 centers, and I'll talk about the different levels later, but 199 level 4 centers, 57 level 3 centers, and of that 256 of those centers, 110 are purely adult centers. The others are either combination adult and pediatrics or purely pediatric centers. So there's actually not that many in the US. And the mission statement of the NAEC is to, the NAEC supports epilepsy centers in delivering quality comprehensive care to people with epilepsy by setting standards of care, advocating for access to high quality epilepsy center services, and providing knowledge and resources to its member centers. So the NAEC designates different levels of epilepsy care. So when somebody maybe presents to the emergency room with a seizure, or they start having seizures and they see their primary care provider, their PCP, that's level 1 care. That's really the front line of medical care, where if you were to have a seizure, you might be seeing one of these people first. Level 2 is when you have a consultation with a general neurologist. So these are neurologists who have gone through their neurology residency. They get trained on a whole bunch of things. So, Alzheimer's disease, Parkinson's disease, strokes, epilepsy, multiple sclerosis. So they do all sorts of neurological care. And that would be a level 2 level of care. And then levels 3 and 4 care for epilepsy, they take place at specialized epilepsy centers. So when we talk about these specialized epilepsy centers, a lot of it is really based on this one report, these guidelines. And this is like a over 10-page document that, and I won't bore you with all the details, but it really goes into what an epilepsy center should have. And this was written the document was created by the National Association of Epilepsy Centers, and it was published in Epilepsia, which is our epilepsy specialists, that's our the main medical journal. So it looks at essential services, personnel, facilities at these specialized epilepsy centers. And there's been about 3 versions since 1987, so they're not updated super recently, and that's why the 2010 guidelines are the most recent. But this document establishes what an epilepsy center should contain. So I mentioned earlier that level 3 and 4 centers are really these specialized epilepsy centers. And so first I'll start with level 3. So a level 3 center has EEG services, including long-term monitoring. So oftentimes when somebody gets an EEG for the first time, it's often a 20-minute routine EEG. So they measure out all the electrodes on somebody's head, they glue all the wires on, and then they record for 20 minutes. And that's just a short EEG. But at an epilepsy center, there's long-term monitoring. And yeah, so I'll talk more about that later. There's epilepsy surgery services, there's neuroimaging, neuropsychological services, what I mentioned earlier with memory and cognitive testing. There's pharmacologic expertise, for example, checking blood tests to see how much seizure medicine might be in your bloodstream. Rehabilitation services, consults with different subspecialists, so neurosurgeons, psychiatrists, pediatrics, OBGYN, et cetera. And then there's a lot of personnel that I also mentioned earlier, and I won't go over that again, but there's a lot that goes into high quality epilepsy care. So I do want to focus on long-term monitoring. So there's a lot of different types of long-term EEG monitoring. Sometimes if somebody ends up in the neuro ICU, like with those examples I mentioned earlier, having had a traumatic brain injury or bleeding in the brain, or brain surgery, brain tumors, sometimes they end up on long-term EEG monitoring in an acute setting to look for seizures. But when I mention long-term monitoring here, I'm more specifically talking about an epilepsy monitoring unit, or what we call the EMU. So an epilepsy monitoring unit is an inpatient unit at a hospital specifically designated for patients with seizures. And the purpose is really to characterize ongoing seizure symptoms and guide individual treatment decisions. So, for example, a patient comes into the epilepsy monitoring unit, they're usually brought in electively, meaning that it's scheduled beforehand. It's not that the patient came through the emergency room. It's a scheduled test. And when they come in, they get all these wires on their head. So this is actually our administrative assistant who's getting electrodes placed by Faye, who's our head technologist. But they get EEG electrodes placed, they have heart monitoring, and also there's video monitoring. And then in an epilepsy monitoring unit, a patient's medications, if they're on a seizure medication, are often reduced, tapered, and potentially until they're completely stopped, so that we can try to see what a patient's episodes look like. So on average, a patient stays in the hospital for 3 to 4 days, but we sometimes keep patients even up to 1 to 2 weeks, depending on the purpose of epilepsy monitoring. So first of all, we confirm whether somebody has seizures, so we can take a look, and sometimes it ends up being like a heart condition, or some other type of condition, because not all episodes are always seizures. And we can try to record these, and if somebody does have confirmed seizures, we can potentially see what seizure type it is. So there's different types of seizures. Seizures can come from different areas of the brain. And using that information, that really helps guide any one individual's treatments. For example, with specific medications that may only work for specific seizure types, or for the purpose of pre-surgical evaluation for potential epilepsy surgery or placement of a device. So now I'll talk about level 4 centers. So in addition to everything that a level 3 center does, a level 4 center is the highest level of epilepsy care. So these are centers that do high volume EMU monitoring. So there is a requirement, there was an exception during COVID, but in general, 100 plus admissions per year to an epilepsy monitoring unit. And then there are a lot of additional features relating to epilepsy surgery. For example, more custom tailored types of epilepsy surgery, mapping out in the brain whether there's like areas responsible for speech or for movement, so that those areas can be avoided during an epilepsy surgery. Placement of intracranial electrodes. So for example, when we bring people into the epilepsy monitoring unit, we're only measuring brain waves from the surface of the brain, but in certain situations, it may be beneficial to actually put electrodes directly on the brain surface or into the brain to look for seizures and to try to figure out where seizures are coming from. Sorry, I'm in a room that I need to move around to get the light back on. So, all right. So, and then more specialized neuroimaging. So in addition to just brain MRI, things like PET scans or SPECT scans. So these are additional things that a level 4 epilepsy center is capable of. All right, so the next question that I'm going to answer is, what is an epileptologist? You may have seen this, heard this term before. An epileptologist is a neurologist who has specific expertise in treating seizures and reading EEGs. So if you wanted to become an epileptologist, I wanted to lay out our training pathway, because it's definitely a long road to get there. So first of all, in addition to 4 years of college and undergraduate degree, then there's 4 years of medical school, a medical degree, for example, an MD or DO degree, 1 year of internship training, and then 3 years of neurology residency training, and then passing the initial certification in neurology board exam. So at that point, then that person becomes a general neurologist. They're able to do the full scope of neurology care, which includes treating patients who have seizures and epilepsy and reading EEGs. So usually in a neurology residency training program, it's very variable how much EEG training general neurologists get. I know at my program, there was no minimum limit. Some people did, well, there was a minimum as far as 1 month, but some people chose to do 1 month, or some people chose to do like 3 months or more of EEG training. So it's very variable how much exposure people get. And then after, if you want to go on to become an epilepsy specialist, then that's an additional 1 to 2 years of fellowship training. That's during that time, fellowship training is dedicated to treating patients who have seizures and epilepsy full-time and reading EEG studies. So becoming very proficient in that. And then passing the initial certification in epilepsy board exam. So the American Board of Psychiatry and Neurology, the ABPN, so they've been providing board certification for psychiatrists and neurologists since 1935. So it's been a very, they've been around for a long time. So in general, especially the employed psychiatrists and neurologists are going to be board certified, and they'll keep up their board certification over time. It's kind of interesting to look at the different specialties that have developed. You can see that in 1992, there was a subspecialty called clinical neurophysiology. And at the time, they kind of clumped together a bunch of different types of studies, including EEG, so that's electroencephalography, so putting electrodes on the head and looking at brain waves, nerve conduction studies, and EMG, electromyography, and that's really a muscle test. So looking at the peripheral nerves and muscles, and seeing if patients have like peripheral nerve issues versus spine issues, and also evoke potentials. So it's a bunch of different tests that were put together, and people became clinical neurophysiologists. But it's really been more recently, so in 2013, that epilepsy became a field of its own. And people who were already doing epilepsy care for half-time or more were allowed to take the test to become board certified epileptologists. So since 2013, all the epilepsy programs, the fellowships that I mentioned, that's really the pathway to become a board certified epileptologist. Okay, so a little bit about epilepsy care in Hawaii. So we're lucky enough to have 5 board certified epileptologists in Hawaii. So there's Keith Abe. Dr. Keith Abe is the only one who's a pediatric epileptologist, and then Dr. Leslie Rosinski, Dr. Allenstein, Dr. Vimala Vajala, and myself are board certified epileptologists. And then in Hawaii, the one NAEC level 4 center. So there's no level 3 centers, but the NAEC level 4 center is the Queens Medical Center, the Queens Comprehensive Medical Center, Comprehensive Epilepsy Center. All right, so in summary, an epilepsy center provides a team approach to comprehensive epilepsy care. The goal of seizure treatment is always no seizures, no side effects. So especially if you have uncontrolled seizures, medication side effects, or considering pregnancy, you should seek care at an epilepsy center. Even though I think good care is offered to all of those who have seizures or epilepsy. The NAEC sets national standards and provides accreditation for epilepsy centers. epileptologists or neurologists who have expertise in treating seizures and reading EEGs, and the ABPN provides board certification for epileptologists. Okay. So just a little bit about our center. We are a level 4 center at Queens. We have 3 board certified epileptologists. We also have Minnie, who's our wonderful epilepsy program coordinator. She's a registered nurse and provides all kinds of education and counseling about medications and studies for our patients with seizures. And we're located at Punch Bowl downtown, Eva Beach, and do telemedicine care also. All right. Thanks. So that's all I have. Yeah, it was a short talk. There wasn't too much to discuss. Anyone have any questions?
Any questions? Anyone you can unmute yourself or you can type it in the chat. That's entirely up to you. There's a lot of great information. If anyone has any questions, do it now. Okay, so one question came in. Are there qualifications to be seen by an epileptologist? How do we get a referral?
Yeah, that's a good question. So there aren't really qualifications per se. I think if anybody is having seizures or seizure-like episodes, so for example, the diagnosis is in question or there's uncontrolled seizures, then that's usually appropriate to be seen by an epileptologist. The Queens Epilepsy Center, I can probably use the chat box to type in that information because I don't have a slide that has our contact info. So Queens Comprehensive Epilepsy Center. So phone 808-691-8866. Yeah, so we have our Queens Neuroscience Institute. So we have actually a number of neurology subspecialists, not just in epilepsy, but all different neurological subspecialties. But we all have that same phone number, which is that 808-691-8866. And so if a referral is placed to Queens Neurology, then it'll get kind of triaged into the right group. So if somebody's having seizures, they'll come to the epileptologists. Sometimes if somebody is having something that might not exactly be seizures, for example, they're having a tremor, then sometimes that gets diverted to the movement disorder specialists. They're the ones that see like Parkinson's disease and Huntington's disease, other movement disorders, and they can manage tremor, which is a little bit different from seizures. Any other questions? Yeah, it's a pretty straightforward topic. Thanks, Minnie. Yeah. Yeah, definitely. Yeah, Minnie is our epilepsy program coordinator and our cheerleader also. So we appreciate you, Minnie. So another question or another comment for patients with developmental disabilities. This is a great help. Yeah, we definitely see a lot of patients who have cerebral palsy, who have intellectual disability, developmental delay. And I think it's helpful that we have this multidisciplinary team to help, and definitely expertise in managing cases where patients have daily seizures, uncontrollable seizures, in need of like very specialized medications. Next question, if we don't have a PCP but want to see somebody at the center, so that's a little bit more insurance dependent. We generally take all insurance types, but some insurances do require a referral from a PCP. So in those cases, you would need a referral. Some insurances allow for self-referral, meaning that you're allowed to just establish care with a specialist and not needing an actual referral from somebody. So you could try calling the Epilepsy Center, and they can work with you to see what your insurance requires. Great. Anything else? Yeah, mahalo. Nurses are kind and got you an appointment. Yeah, I'm glad to hear the positive feedback. Yeah.
Does Queens service beyond Hawaii, like American Samoa, Guam, American territories in the Pacific, or is it just the main Hawaiian Islands?
Yeah, so we definitely, it's rare, but I do, so patients who can physically come to Oahu for care, I have had patients who are from both American Samoa and Guam. I do see, yeah, I do have one patient who's seen remotely by telemedicine. So it is doable, but I think we don't really have that pipeline kind of, that there are some obstacles. Yeah, so I know that the telemedicine team, they're definitely working on it so that we can provide that care beyond just the state of Hawaii. So yeah, it's doable, but with with some obstacles for now. Yeah.
Speaking of telemedicine, would you mind just talking a little bit for our neighbor island folks, a little bit about your treatments with telemedicine?
Yeah, definitely. So telemedicine, we're definitely offering, and in fact, we prefer it at this point, given the COVID-19 pandemic. About 20% of our patients are neighbor island patients, and we're seeing the large majority of them by telemedicine. We do have a default platform that's integrated into our electronic medical system. So patients can go through My Chart, if you're familiar with that, to set up a telemedicine visit. But we also have backup options like Zoom and WebEx. And during the pandemic, they actually had an emergency injunction that allowed for us to use non-secure platforms. So I know a lot of doctors are using FaceTime, for example. Temporarily, that's also an option. So we are seeing new patients by telemedicine. We're seeing follow-ups by telemedicine. It's definitely been, yeah, it's been a helpful tool. We were kind of set up with that even pre-pandemic because a lot of patients who have seizures have driving restrictions. So it's been nice for them to be able to do telemedicine. The one thing that we cannot do by telemedicine on neighbor islands is EEGs, unfortunately. So we don't have techs set up out there or the equipment, and and there's no like networked way to send EEG studies for us to read. So we still are needing people to come to Oahu if they need any EEG testing. For brain imaging, it's kind of, it's dependent on each individual patient situation. If we're doing like a screening MRI, oftentimes we can have those done on the neighbor islands and then actually have those images beamed over to look at directly. But sometimes if we want a specific epilepsy protocoled MRI looking at specific areas of the brain, then we do want people to come to Oahu so that we can get that level of that quality of study. Yeah. So yeah, insurance doesn't require referral. Yeah, so I think usually the front desk staff handles that. So yeah, calling the front desk, they can kind of work with you to see which neurology provider is the most appropriate. Yeah, grateful for telehealth option. Yeah, we've really appreciated having telehealth also on the physician end. So yeah, looking forward to seeing you, Michaela. Great. Anything else?
Any other questions? If not, sure, everyone?
Yeah. Yeah, thank you everyone for spending your evening listening about accreditations. It's not very exciting.
Well, there was 10 people here that were very interested. out of our whole listserv and our social media 10 who showed up tonight and able to show up and learn about the accreditations, which is very important. You know, it's some people have never heard of it, so they just want to know. You know, I'm sorry. I'm on my porch because my internet is so sketchy. But anyways, Dr. Wong, you know, thank you so much for all that you shared today. And then of course, always being available to share it. And to everyone else, thank you all for your time, your great questions, discussion points. I hope that this has given you more to think about in terms of epilepsy centers and their levels of care, whether you're a person with epilepsy, you're a caregiver, or you know someone who lives with epilepsy and seizures. Thank you for making the time today. I am going to now end the recording.